In this series, we interviewed 5 amazing healthcare leaders and experts about the digital health industry in the age of AI and digital transformation. In this video, we asked, what is one pitfall emerging digital health startups want to avoid? This is the 4th video in a series, so if you missed the first 3, check the description.
So, this is one thing that I always used to say as a CIO, since I've been on both sides of the equation. I felt like so many times companies would come in, they'd write $100, they sat in a whiteboard room, they write $100 per provider per month, and then they work backwards as to what they were going to build. So you need to have experts from the provider organizations at the beginning. You can't, just because you had a bad experience in the doctor's office and you think that you can solve the problem, doesn't mean that you can solve the problem. Your one episode does not qualify you for solving the problem. It does give you a motivation, but it doesn't actually give you the overall knowledge to solve a major clinical issue or solve healthcare as a whole. You need to partner with an organization that can actually deliver meaningful outcomes. So make sure that before you build anything, you have a partner organization that's going to be able to bring it to market. Otherwise, you're just going to be left with a technology that nobody's going to be implementing.
So a lot of the folks that I work with, like myself, are very mission driven, and that is incredible, and it's very important. I think the impact that we seek to make on humanity cannot be underestimated, and it's probably the thing that puts that fire in your belly. One thing I would really encourage my colleagues in this space to consider is really double down on your business case. A lot of times solving an important problem is not only makes sense for a very human reason, but it makes sense for a business reason as well. So especially for our early stage founders, double down. If you're an impact or mission driven founder, do not forget to put as much effort into the business as you do in that sort of passion and mission driven focus.
Being overly optimistic and aggressive in understanding how to get to a health system. You don't just buy something that someone developed in their garage and put it in a patient's lap. So again, technology happens through an evolution. It's okay to have a POC and understand that it's just a proof of concept. But there's a lot that goes into technology and innovation touching the patient. And there's a fiduciary duty of the hospital to protect that patient. So you don't just add technology to the patient's chart and say, you're fixed, and we hope nothing goes wrong 3 months from now.
I think the biggest challenge would be probably financing, is having the ability for any small business to sustain itself for the first few years before the idea catches on. And I think that's true across all businesses. There's a lot of startups in healthcare, and if they can get by, if they have a great idea and can get by the financing stage, I think there's a lot of opportunity. Healthcare is 20% of our economy, so there's a lot of opportunity there.
So number one is patient first, right? Don't build a tool if you don't understand the problem. Spend as much time understanding the problem or more than actually building the tool. That's number one, right? Number two is make sure you're building the right people, process, and culture in your company, right? So first 5 people define what the culture is. Number 3 is you need to understand your inner why you're doing it, right? So like my inner why is I want to solve a problem that somebody I love is affected by and create a social impact at the same time. Whatever you're trying to do needs to align with your inner why. Otherwise, it'll feel you won't be able to do what you're trying to do. You need to build for scale from day one, right? If you really want to make a difference in people's life, you need to think exponentially, not linearly. And it's really hard because our brain doesn't think exponentially, it thinks linearly. So it's really hard to put your mindset in that. Think about today is going to be 1 customer, then 10, then 100, then 1,000, then 10,000, then 100,000, then million. Not 1, 2, 3, 4, right? So you need to kind of think like that to make that happen. If you're trying to raise money, make sure you're raising for what you need and not overdoing it. the more you raise, the more you spend, and the more waste it is. Sometimes, controlled fundraising helps you focus better. And last one really is focus, focus, focus. There will be thousands of opportunities. You have to say 1,000 no's or 100 no's. So that team focuses on one true thing that you're trying to make a difference on.